It's my feel-good breakfast show.
Welcome back. It is your feel-good breakfast show, Expresso on S3. Now, the number of people who died amid a cholera outbreak in Hammanskraal, north of Pretoria, has risen to more than 15, according to the Gauteng Health Department. Now, Mayor Cholera Brink visited the area yesterday and was met by protesting residents who said they did not recognize any government officials.
So the mayor joins us on the line now to chat more about the outbreak and, of course, what the city's plans are in dealing with the situation. Naturally, your Feel Good Breakfast Show, we care dearly about these types of issues and we'd like to get you some answers. And that's why we have the mayor on the line. Good morning, Mr. Mayor. How are you doing?
Good morning, Carl. I'm doing well. How are you doing?
Fantastic, thank you. We are looking to ask the hard questions, but it's vitally important because the situation is at a point where the entire country is concerned. So can we start off with, how did it get to this point where the tap water is so unsafe to drink?
Well, Carl, first of all, it's very important that we first determine the source of the cholera outbreak. There's been a lot of speculation, people assuming that it is the tap water. Yesterday, the results came through of various tests that the city did on Saturday on water sources in the timber supply area, including reservoirs, fire hydrants, schools, and streams. And those tests, in fact, came out as negative for cholera and lethal levels of E. coli. So we have to cast our net wider. We've shared this information with Gauteng health authorities. Now, that does not mean that the water in timber is safe for public consumption. As you know, the city warned for months that due to problems at the Rooiwal wastewater treatment plant, folks should not treat their tap water in the timber area as safe. And that's why water tankers are provided and guidance is provided on how to treat that water. And we can speak about that long-standing issue of Hammanskraal water. But the important point is not to assume where the cholera comes from, because until we've determined that, we will not be able to effectively contain the situation.
I hear you, Mayor. Now, Mayor, I know yesterday you visited the area. Do you have a response to what the community that chased officials away yesterday?
Well, I think it's important just to understand the situation on the grounds. Very often there is protests and violence by a small group of people, and then the tendency is to say the community did this or the community did that. Essentially, yesterday's 20 people that prevented me from entering the Jubilee Hospital were a political renter crowd. There was councillors there. It was a politically staged type of show. Unfortunately, they attacked my protection officers and my staff, and they effectively prevented me from meeting with the deputy ministers. Luckily, two members of my team, the member for the Mayoral Committee for Utility Services as well as Health, Tembafosi and Rina Marx, were there already. So our job wasn't prevented from being done. At the same time, Zoe, I do understand the frustration and the anger of the community about the long-standing issue around water, as well as the deaths from cholera and the need for us to contain it. But I truly think that most community members would want the mayor, the other public officials to answer questions, to examine the situation, instead of blocking their entry to do their work.
It's very sad that these types of things, when it comes to the health of people, have to be politicized. But I know that everybody needs to stick together at this particular stage. But the big question is, are there plans in place from the city to be able to combat the spread of this bacteria? Is there enough infrastructure, enough information? How are we going to actually combat the likes of this and, of course, its spread?
So as I mentioned, priority number one is to detect the source, to isolate it, and then to prevent the spread. We're working with Gauteng health authorities to make available as much treatment capacity as possible. Obviously, the Jubilee Hospital is a provincial facility, but the city has tertiary healthcare responsibilities. We're assisting with the distribution of pamphlets to inform the community of the risks around cholera, the importance of hand hygiene, the importance of not consuming the tap water around the timber area, but instead to use the water supplied by water tankers, and various other practical public health information is being distributed by the city. My colleague responsible for health in the city, Rina Marx, is a healthcare professional, and she has really been instrumental in assisting the province. So from the city side, we are doing everything possible to contain the situation, but obviously this is a project where all spheres of government will have to do their part, and I think at present the situation is being managed as well as it possibly could. There is a joint operational command center in place, a disaster management declaration 3, which means we're monitoring and evaluating the situation. The different spheres of government are communicating with each other, and where there's assistance needed by the families, including the victims of, or the survivors of those who passed away, the city will give all necessary support.
Well, Mayor, thank you so much for joining us this morning and shedding some advice, encouraging the public not to drink the tap water in the Temba area. And thank you for also just showing us that the city of Tshwane is doing things and making sure that citizens are safe. So thank you so much for your time this morning and shedding some light on the situation.
Thanks very much, Zoe.
Thank you so much to the Mayor. And of course, let's shed some light onto other communities doing some great work.